Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello, welcome to today's presentation, Treating Carotid and Aortic Disease Through Endovascular Innovation, presented by Dr. Stella Asuquo, vascular surgeon with Washington Township Medical Foundation. Dr. Asuquo is board certified in both general and vascular surgery. She chose vascular surgery for two simple reasons: the very diverse nature of the specialty and the long-term relationships built around her patients' care. Thanks to her training in both general and vascular surgery, Dr. Asuquo has a wide range of knowledge and expertise as it relates to applying minimally invasive, cutting-edge, and evidence-based surgical treatments. This background aids in her decision-making process that is centered on what is best for her patient. Please welcome Dr. Asuquo.
Thank you for having me, and I'm delighted to discuss endovascular management of carotid and aortic disease. Let's talk about carotid artery disease. What is it and why does it matter? Carotid artery disease involves disease or narrowing of the carotid arteries. The carotid artery is a major blood vessel that supplies blood flow to the brain. It comes up from the chest into the neck and divides into a branch that goes primarily to the brain and another branch that supplies the muscles of the face. Why does it matter? If there is narrowing or blockage of this artery, this can lead to stroke. And stroke is a leading cause of death and disability in the United States and worldwide. The main goal of treating carotid disease is to prevent stroke in the future. Again, let's talk about why it matters. Carotid artery disease is responsible for 15 to 20% of all strokes, and stroke is a leading cause of death and disability. Endovascular management of carotid disease refers to a minimally invasive management of this disease. As previously mentioned, the goal of any intervention on carotid disease is to decrease the risk of disabling stroke. Again, endovascular management, which is a minimally invasive technique when compared to open surgical techniques. Specifically, this refers to putting a stent in the carotid artery to widen that artery, improve blood flow, and decrease the risk of having a stroke. There are two main ways carotid stents are delivered. One through something called a transcarotid artery revascularization, TCAR, and another through a transfemoral carotid artery stenting. Again, the goal or the primary outcome of either surgical technique is that a stent is delivered, widening the artery, improving blood flow to the brain, decreasing the risk of stroke. The transfemoral carotid artery stenting happens through the blood vessels in the groin, ideally with some cerebral protection to prevent that plaque from going up to the brain. Here is an example of the delivery sheath with the wires across and some form of a protection to prevent this plaque from going up as we prepare to deliver the stent. You've come up through the blood vessels in the groin and brought all of your tools to deliver the stent. Here is an example of a very diseased carotid artery that's narrowed, and here is a good result after you have placed the stent. Again, these are different examples of very narrowed and diseased carotid vessels and after placement of a stent. Further examples of this as well: a very narrowed and diseased carotid vessels, a catheter that has been delivered from the groin with an attempt to get the stent delivered to the area of the disease. Once the stent has been deployed, you can see the improvement and widening of that blood vessel. Transcarotid artery revascularization is the other minimally invasive technique for delivering the carotid artery stent. In this case, the access is done through an incision at the base of the neck. The way the brain is protected is with something called flow reversal, so the blood flow is directed away from the brain. And the advantage of this technique is that you don't have to come in from the groin and you don't have to deal with the complications that may be associated with coming in from the groin. Here is an example of such a delivery system. You had an incision at the base of the neck and everything is being done from the blood vessels in the neck. Here at Washington Hospital, we have several specialists that work together, and if you have been discovered to have carotid artery disease, it is truly a multidisciplinary effort with your primary care physician, perhaps the hospitalist that's taking care of you in the hospital, the neurologist, and your surgeons and interventionalists to provide you the care that's needed for management of that carotid disease, whether that's surgery or non-surgical management. Now we will talk about aortic disease. There are many different types of aortic diseases and pathologies. These include aneurysms, dissections, penetrating aortic ulcers, and traumatic aortic injuries. Aneurysms are abnormal ballooning of the aorta. Dissections is an injury that has happened to the wall of the aorta, causing the blood flow to be abnormal. Penetrating aortic ulcers are where the calcification in the wall of the aorta perhaps causes injury to the aorta, causing some abnormal protrusions or false aneurysms of the aorta. And finally, traumatic aortic injury can occur in the trauma setting. Many of these aortic pathologies and diseases can be managed by endovascular strategies. Again, minimally invasive techniques. As we previously mentioned, aortic aneurysms are abnormal ballooning and dilatation of the aorta. The most common risk factors for this abnormal ballooning includes smoking, hypertension, systemic atherosclerotic disease, and unfortunately sometimes some people are just genetically predisposed to these conditions. Here is an example of that abnormal ballooning of the aorta. This is in the descending thoracic aorta. And the endovascular management or minimally invasive management with the delivery of a device to treat this abnormal ballooning coming in from the blood vessels in the groin. Anytime you treat an aneurysm, the goal is to decrease blood flow into the aneurysm sac. And that's exactly what an endovascular minimally invasive technique does. Here is another example of an abnormal ballooning and dilatation of the descending thoracic aorta. This is a final result with treatment in a minimally invasive manner with a stent graft. Again, we have excluded blood flow into the aneurysm sac. Here is another example where you're now having blood flowing directly through this tube and no longer filling the aneurysm sac. Here is an example of an abnormal ballooning or aneurysm that is involving the abdominal aorta. Here we are working through the blood vessels in the groin to deliver the stent graft that will prevent further blood flow into the aneurysm sac. Here is a completion of that effort where you have total exclusion of that aneurysm sac and blood flowing directly through that stent graft. Again, illustrations of the effort of coming in through the blood vessels in the groin and delivering the final device, excluding any further blood flow into the aneurysm sac. Let's talk about aortic trauma or blunt aortic trauma, which is what is most commonly managed by minimally invasive techniques. This involves such force to the aorta that there is a rupture somewhere. Oftentimes this is a contained rupture, and you can now see that the contour of the pipe or the aorta is now abnormal, and you can manage this again with a minimally invasive manner, bringing in the device from the blood vessels in the groin to exclude any further flow to what may be an aneurysm or to manage what may be a contained rupture. Here is an example of such an effort. You can see that there's this abnormal contour to the aorta, and once that is treated, you have re-established the normal contour to the aorta, and you have very minimal irregularities there. That is all, and I will take any questions.
Thank you, Dr. Asuquo. We do have some questions. My first question is, what can patients expect when recovering from minimally invasive endovascular surgical procedures?
The advantage of minimally invasive endovascular procedures is decreased hospital stay and a faster recovery in that perioperative period, because it's not a huge open surgical effort.
I have one more question. Is there anything that patients can do to avoid developing carotid artery disease?
Yes, you should have regular checkups with your primary care physician and minimize your atherosclerotic risk factors, which includes not smoking, making sure that you are on the proper medications for management of your high blood pressure, high cholesterol levels, and perhaps being on an aspirin as well.
This concludes our program. Thank you, Dr. Asuquo, for this insightful presentation. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.